Hi, my name is Mallory, and today we're going to be demonstrating administering a medication IV push through a central line, specifically a PICC line today. First thing I'm going to do is take a look at my MAR. I'm going to make sure I have the right patient. So I have Jennifer Doe. Her date of birth is 11/5/75. She has no known drug allergies, and we have an order here for morphine, 7 milligrams IV push every 3 hours for pain. So last time we were in there, we did a pain assessment. She was rating her pain at an 8 out of a 10. So we are going to go ahead and give her and administer this morphine order. So because I'm giving morphine, I'm going to want to check my compatibility. So we're looking at morphine, and I know we're going to need it to be compatible with normal saline because we have some saline flushes here that we're going to be pushing with it and diluting it in. So just making sure that it's compatible there. And then we'll take a look at our drug book here. And we're gonna look at, one more page. We're looking at the administration guidelines. So first of all, we wanna know how much to dilute it in. So they're saying at least 5 milliliters of sterile water. And then we also want to know how quickly to give it over, and it says give 2.5 to 10 milligrams. Our order is for 7, which is over 4 to 5 minutes. So we're going to go with the longer duration just to be safe. So we'll go ahead and give this medication over 5 minutes, and we'll dilute it in at least 5 milliliters of sterile water. So as far as supplies go, I've got some hand sanitizer here, 3 saline flushes, 10 milliliter saline flushes. We've got our medication. I've checked the expiration dates on all of those and they're good. We have our vial access device, some alcohol prep pads, and some tape to label the syringe once we have it diluted. I'm gonna go ahead and get that ready right now. Maybe.
6 hours later.
Maybe not. We'll wait on that one. So first I'm going to start by washing my hands. Okay, so now that my hands are washed, I want to calculate my dosage, make sure that I have the right dose. So in here we have 10 milligrams per 2 milliliters. And so according to that and my order of 7 milligrams, I have the following math to give us 1.4 milliliters for this dose. So now that I know I need 1.4 milliliters, I can go ahead and waste. I'm gonna need another nurse to help me waste. Jordan is gonna be that other nurse for me today.
Sure thing.
So I'll go ahead and uncap. I wanna make sure to set this down up so that we maintain sterility. And then I'm gonna waste in the appropriate receptacle. Using the trash here, but a lot of times they'll have like a black box or something to waste in. So get the air out of here. There we go. Okay, so once I have 1.4 milliliters, I'm gonna go ahead and recap that, and then I'm gonna have my second nurse double check that.
Perfect. And let
Yeah,
me
make sure you.
come on.
Here. Let me see the camera really quick. I'll just make sure we get it. It does not want to focus. There we go.
Perfect.
So,
I've also looked at it.
just so they can see. Okay, that should be good. Thanks. Okay, so now that we're dose accurate, I can set that aside. So now we want to dilute it, but before we dilute it, we want to make sure we do our checks. So medication in hand, comparing my medication and my dose here. I've got my math, so I know that we're 1.4 milliliters. I'm going to do my 5 rights 3 times. So we have Jennifer Doe. We have an order for morphine, 7 milligrams. Double checking this is morphine. 7 milligrams came out to 1.4 milliliters, which is correct. I have 1.4 milliliters here. Every 3 hours as needed for pain. And then IV push is how we're giving it. So once again, we have Jennifer Doe, morphine. Checking that I have morphine. 7 milligrams, which is 1.4 milliliters. 1.4 milliliters. IV push every 3 hours as needed for pain. Last time, Jennifer Doe. We have morphine sulfate. Morphine, 7 milligrams is the order. I have, which we know is 1.4 milliliters. I've got 1.4 milliliters in my syringe, and that's IV push every 3 hours or PRN for pain. So now that we've done our 3 checks, we can go ahead and dilute the medication. So once again, leaving the cap up to maintain sterility here. I'm just gonna waste down to about 5 milliliters. And then I'll pull back a little bit so we have room for, the medication to go in. It was a little more than 5 milliliters, but drug book said minimum of 5, so I think we're good. And then just recap that for a second. Go ahead and get our vial access device on here. Pull that out. Once again, setting that face up. We're gonna instill our medication in here. This would go dispose of in the sharps container. Get our cap back on here. Actually, I will get the air out of here without wasting any medication. Okay, so once we have that diluted, I'm gonna go ahead and label it, and here it goes. On my label, I'm gonna put the date and time that it was drawn up, the actual medication and the dose that's inside this vial, as well as my initials and probably the initials of my patient to make sure I don't give it to the wrong person. Just put those off to the side. Okay, so now that we have everything correct and ready to go, I'm gonna go ahead and enter the patient room. Hi, Jennifer. My name's Mallory. I'm gonna be your student nurse today. I heard that you're in some pain and you're looking to get some medication to help with that. Is that correct?
It is.
Okay, good. Well, I've got some morphine with me. Have you taken morphine before?
Nope.
Okay. Well, morphine's an opioid analgesic, so it's a pretty strong pain medication. Should have no problems taking care of your pain. There are some side effects we'll want you to be careful of. If you start to get too drowsy, if breathing starts to become labored or difficult, anything like that. Some of the more common ones might be nausea and vomiting, so if you do feel any of that, let me know while we're here, and we can help you out with that. So I'm just going to check one last time to make sure I have the right medication. I know I have it labeled, so Jennifer, can you give me your name and date of birth?
Jennifer Doe, 11/5/75.
Perfect, and that matches her ID band as well as the MAR. And then I'm just double checking we have the morphine 7 milligrams IV push, and that is what my label says, so we are good to go. All right, and we would want to do get some baseline assessments in, so probably some cardiac and respiratory assessments, checking her respiratory rate, her blood pressure, things like that, so that we can monitor those things as she's given this medication to make sure that she's not having any adverse reactions or too severe reactions. And so far all of those things are within normal limits, so we know we're good to go ahead and administer the medication. So I have provided for privacy. We've explained the procedure. So I'm gonna go ahead and wash my hands again and put on some gloves. So first thing we want to do is assess her insertion site. We're going to take a look at it, make sure there's no signs of infection, infiltration, anything like that. Things we'd be looking for would be like redness, any pain or tenderness around the insertion site, any bruising, swelling, anything like that. Everything looks good, so we're going to assume this is still paint and line. And we'd also want to make sure, something that we're doing every day is making sure that the central line is still necessary. So in this patient's case, she has ripped out her peripheral IV. So with these IV medications that we have, we've got to have some way of administering it. So first thing we'll do is alcohol swab here. And if there was a clamp on there, I'd want to unclamp it before I started pushing anything through. So we'll alcohol swab that. We're going to attach one of our flushes, making sure to get the air bubble out of it. Attach that flush, and because it is a PICC line, we're going to use that pulsing medication. One thing you'd want to check is if your agency policy has if they typically use a heparin lock, you'd want to make sure to aspirate the heparin out so you're not pushing that medication into the patient's bloodstream. Once we have that first flush done, we can throw that away. We would clamp it again. Get another alcohol swab. We're going to swab in between every time. And we'll want to hook up our medication. Once again, making sure there's no air bubble. Attach that. So we know we're going to push this over 5 minutes. So I'm going to go ahead and make sure I note the start time. And we're going to push it slowly over 5 minutes. And to speed things up, we are going to go a little faster for this demonstration purposes. So we'll say the 5 minutes is up. I'll make sure to assess her, make sure she's tolerating the procedure well. Get another alcohol swab here. And we've got one last flush to do. So with this last flush, once again, making sure we got the air bubble. With this last flush, first 30 seconds need to go at the same rate that we did the other one, and then we can pulse it through. Lifespan considerations, if this was a younger pediatric patient, we would want to make sure, and clamping that, we'd want to make sure that our dosage includes weight base. We might also push it over a slower amount of time. Doing that again, and at the very end, depending on agency policy, we put an alcohol impregnated cap on the end. Make sure it's clamped. In this case, we just did an extra alcohol swab. So I'm going to remove my gloves, wash my hands, make sure the patient's comfortable, bed is low, call lights within reach, etc. And we would document. So I'm going to document time, date, time of administration, how the patient tolerated it, any assessments we did, and that's it.